once again, back at the BioHorizons meeting with Dental XP, and we actually have a fascinating guy with us, a friend, really one of the people who was at the forefront, in fact one of the people who was instrumental in developing computer-guided surgeries. And I remember Mike doing that as he came out of literally graduate school, actually in graduate school, as you were doing it.
That's right. That's right. Back in October of 1989 is when I first became involved with CT scan technology. So, yeah, so at the very onset of the use of reformatted CT within implant dentistry, I became fascinated with it.
And I remember you actually making surgical guides with drill presses. I mean, just mechanical drill presses that were essentially from Home Depot or Ace Hardware.
That's right. That's right. That was, you know, at the time, that's what we had that was available. Actually, a very short story. I became interested. I was fascinated with CT when I was a resident. The reformatted CT had first been introduced into implant dentistry by a company called MPDI, and then very rapidly afterwards a company called 3D Dental. And I was at an American Academy of Implant Dentistry meeting that was held at the Point at South Mountain in Phoenix, Arizona. And I was walking through the exhibit hall with a friend of mine, and he stopped by the 3D Dental booth, and he asked the salesman there a question about CT, why his measurements weren't working right, and I listened to him, and then he walked away, and I walked back over to the salesman and said, you know, I don't understand your answer at all. I didn't even understand my friend's question, what you were talking about with CT. And he began to explain to me about the problem, you know, and why it occurs. And I went back and I thought about it. About 3 hours later, I walked over to him at the pool and I said, you know, I know how to fix your problem. And that's how I got started, you know, with my involvement with, let's call it the technology of CT.
And you've seen it really evolve to the state it is now, where it's essentially, I think, becoming more and more integral to people's practices, certainly to safe practice. It may well become the standard of care. But along the way, you've seen a large number of these so-called problems. And I think many people were somewhat disillusioned at different times with some of the systems, while very sophisticated, quite complex and difficult to use. Whereas I think now they're considerably easier, but still difficult.
Yes, well, you know, there's been evolution of this technology. Most of the technology with most of the systems is somewhat sophisticated and complex. And I think one of the goals of all of the tools and techniques that we use is to convert them into science, which means everybody should be able to understand them, use them in the same way, and obtain the same results. With this type of technology, it's computer technology. And like with any other computer technology, it's garbage in, garbage out. And so you need to understand how to use the technology, what its limitations are, you know, what its benefits are, and then you can use it appropriately and understand what the expected outcome should be.
But it is considerably more user-friendly than it was.
Yes, that, you know, for sure.
And the learning curve, I don't believe, is as steep as it was initially.
No, the learning curve, I think, should be relatively quick and short for most people. The potential problem is that a lot of people look at this and say, well, you know, I can do that. And so here's where I'm going to use computer-guided surgery. I'm going to pick the most complicated, difficult thing that I can find because that's where I need the assistance. And that's where I'm going to try my first case. And so when you go ahead and you try something that's complex or try something that's complex and difficult the first time, you know, frequently you're going to miss something along the way. And so perhaps a better place to start is someplace where it's relatively simple and straightforward. And the only thing you have to think and worry about is the computer-guided technology, not the procedure itself. And you'll probably have a better outcome or more predictable outcome in that scenario.
So you're actually suggesting using it where most people would think it's unnecessary to use it, whereas originally I think we thought about using it to avoid issues such as nerve impingement. I mean, that really was one of the biggest factors. Now with time, as we've gone through things such as immediate placement, you can actually direct that implant exactly where you want to do it to avoid the buccal plate, to access the palatal bone. to do all sorts of things. So you're now talking about a single tooth replacement, and that may well be a better one to do, particularly a delayed case, a stage case.
Well, that's for sure. This is a tool. It's not an all or everything type of tool, and so I think it's something that most people will find that they will learn where they want to use this tool in their practice, and it might be different applications for different procedures, and from one practice to the other. But certainly, starting on a smaller, simpler case to learn the technology is a better place to start.
And do you see the technology evolving now, so it becomes more accessible for more people, perhaps via centers?
We're in the digital age,
right?
And this is certainly a digital tool, and this is going to be, I think, as time goes on, it's going to evolve into one component of a whole series of digital tools. We're in a very exciting time within the area of dentistry, and I see just what's going on in my office, how I have to go ahead and involve computer technology in all the different things that we're going in and doing in staff training and all the tools that we go ahead and use. And slowly, for the next few years, I think we're going to see instead of these tools all being independent, integration of all these tools, whether it's computer guidance in implant dentistry, digital X-rays, whether it's imaging for impression taking. The use of this technology in the dental laboratory is going to be an merging of all this technology as it evolves, probably relatively rapidly. And I think it's a very exciting time to be in this, but also an important time to start learning the fundamentals of this, so that as it evolves, you know how to apply it within your arena.
I mean, right now there are independent aspects of placing the implant, which is obviously has been our focus, but if you go into different arenas, you can see we can generate models with them. You can develop frameworks on those virtual models. I mean, you really can ultimately plan this, perhaps even aesthetically, right from the outset.
I think that what occurred, a very exciting thing occurred when Nobel came into the arena of computer guidance. And they took a huge leap forward in not attacking it from a perspective of evolving computer guidance, but how do we go ahead and put teeth into the patient's mouth as a final restoration. And so they took a big step that we probably really weren't ready for. There were a whole lot of little steps in between that needed to be worked out, and designed and understood before you get to that arena. But that's certainly where we're heading, perhaps not for every patient. There probably will be in the very near future methodologies and techniques and tools where that's what we'll be. We're going to be using a computer-guided, guide, and we're going to be routinely delivering definitive aesthetic restorations at that visit. And
it may well be that place to start is a single tooth, where you could actually put a CEREC on and cement it the same day. I think probably, I'm sure there are people now that are doing that today. Right. Amazing. You're probably doing that today. Mike, it's kind of exciting to be here, and really appreciate you sharing some of these insights with us, and congratulations. We all appreciate all that you've done.
Thank you, Dave. It's exciting to sit here and talk with you and to have been part of this evolution.
Great.